So this is the final thing which we have to do. Now here in this slide you can find the different levels. So I will discuss one by one what are the different levels of the deficiency which are present. So we will discuss first of all for the vitamin A. In the vitamin A we will discuss first of all deficiency whenever it is less than 66%. Then adequacy means it is not deficiency, neither it's a toxicity to us. So that would be around between 700 to 900 microgram. Then toxicity would be there whenever it is going to be higher than 3000 microgram per RE. So that is the thing we have to understand. Now I have wrote here RDI, recommended dietary intake. So if we are taking in the adequate form, even it is not going to harm us. It is not going to give any harmful effect in our body. So that is the very important thing. So you can be in this region or in this region. You cannot go in that region which is toxicity level. So you have to take care it should not be greater than 3000 microgram RE per day. So let's try to understand few of the symptoms which are associated with it. First, whenever it is deficiency, it is known as your hypovitaminaceous. Hypo means deficiency and vitaminosis means due to the vitamins deficiency. So we call this stage hypovitaminosis A. Now what is the problem associated with it? What are the symptoms associated with the hypovitaminosis? First, it having a problem with the bone, tooth. Then central nervous system problem, night blindness means you are not able to visualize properly in the evening. Then complete blindness is also found sometimes, and this complete blindness is known from a term which is known as your xerophthalmia. So this is the term which you can get in exam also. Then there are some problems with the GI system also. So gastrointestinal system has certain problems. These problems are related with the diarrhea, immunity, depressed and infection. And for the skin or the dermatology, there are also one problem which is known as your hyperketosis. So hyperketosis is a problem associated with the thick skin. So these are the certain problems which you can find whenever a person is suffering from the deficiency of the vitamin A. First is your hypovitaminosis A, second is your night blindness which is also known as your xerophthalmia, third is your GI system problems, and fourth is your skin problems. So these are the problems associated with the deficiency part. Now let's try to understand with the adequacy part. So adequacy is the range between 700 to 900 microgram and its RDI is around 5000 IU. Now it would be your normal vision would be there, expressions, reproductions, embryonic development, epithelial cell. So these are the things which are associated with it, and this is not as such having a problem. So we should not be neither in this range nor in this range. So we have to optimize a range which is in between of that. Final is our toxicity. So toxicity comes whenever it is going beyond the 3000 microgram a day. So it is very high. And whenever it is very high, it means we can say there is a problem with the bone and tooth. So what is the problem? It decreases the absorption of the vitamin A and it will lead to the bone mineral density, problems in the central nervous system, headache and GI system problem. So these are the problems which is associated with the toxicity. So in this slide of the vitamin A, we have learned about the deficiency, adequacy and toxicity. In the deficiency, we have also learned about the hypovitaminosis. We have discussed about the bone and teeth problem, GI system problem and skin problem. In the toxicity, we have discussed about what is the same or the opposite effects are there. Now let's talk about the vitamin D. Let's talk about the vitamin D. What are the problems associated with the vitamin D? What are the deficiency which is a problem? What is the adequacy which is a problem? And what is the toxicity level which is a problem? So we will discuss about the deficiency, adequacy and toxicity of the vitamin D. So let's discuss it. So toxicity, it would be more than 50 microgram per day. and whenever it is less than 3 microgram per day, it will lead to you deficiency. So in the deficiency, you know, there is a disease rickets, which is generally found in the children. Second disease is our osteomalacia, which is found in the adult. The same disease is there, but in the adults we call it as the osteomalacia. In the osteomalacia, generally the shape of the bone of our legs will mold. Okay, so it will going to be in the round shaped. Okay, so that is the osteomalacia. Then poor growth and bored, soft bones, pigeon chest. So these are the problems associated with the deficiency of the vitamin D. Now cardiovascular disease can also be a problem, and problem in the GI system also. So these are the problem. Now talk about the toxicity, but because that is very important. So then whenever it is a toxicity, it is known as your term, which is your hypervitaminosis. Hyper means high and vitaminosis, D means synthesis of the vitamin D. So that deficiency is known as your term from the hypervitaminosis D. And its level is there, which I have mentioned, 50 microgram a day. Then weakness is there, central nervous system have a problem, GI system, nausea, vomiting, and these are the other problems which came into the picture. So needs are based upon the inadequate and exposing the sunlight. So exposing the sunlight is very, very important to convert the vitamin D2 to D3, which can be absorbed in our body directly. Now coming to the vitamin E. So vitamin E, we will discuss what is the deficiency, what is the adequacy, and what is the toxicity. So for the vitamin E, the toxicity level is around 10 milligram a day, and it can be 1000 milligram a day whenever we talks about the vitamin E toxicity. So it will lead to the premature infant problem, hemolytic anemia, and in adults not well for the characterized. Now toxicity, it will lead to the non-toxicity, supplements, and these are the anti-blood clotting problems are there. So vitamin E is also help in the clotting also. So when it is going to be high, it will unoptimized. Now vitamin K is there. For vitamin K, it should be less than 60 microgram a day. So it should be 60 microgram per day, and cardiovascular disease can be increased, clotting can be a problem, and its toxicity level is not yet to be determined. So that is the problem, and its DRI whenever it is in the adequacy phase is 9 to 120 gram, and normal blood and the clotting of the bone and metabolism is there. So that is the thing associated with the vitamin K. So now other popular things are there, cinnamon is there, ginseng is there. So these are the certain products which are there in the market for as a supplement. So in these product, you have to identify whether they have optimized or not, whether they are providing right thing or not. Now I have taken the example of the cinnamon also. So we will try to understand the cinnamon in the next class. So thank you so much.